This is the Emergency Medical Minute, sponsored by CarePoint and HCA Health One.
So this is a medical minute, kind of a public health notification. I'm not sure if anybody has heard about this. It was kind of news to me. There is a potential outbreak of infant botulism. So for anybody who hasn't heard about this, there's a formula called ByHeart. That's a brand of formula, I guess, that now is known to have contamination with botulism spores, so not ideal. So just a quick kind of review. Botulism is a spore that can be in honey, is kind of the classic thing, but it can also be just in the environment, in the dirt, anywhere there's construction, or sometimes it gets contaminated in things like infant formula. And the big problem is that infants are especially susceptible because if they get exposed, if they ingest these spores, their body, their stomach acid doesn't neutralize the spores, whereas if an adult ingests these, they usually do fine and don't have any problems. But infants can ingest these spores and then they can start developing botulism toxin, which causes pretty significant weakness. It's classically kind of an ascending paralysis and really affects the bulbar muscles or the muscles of the head and face. And so somebody might present with difficulty feeding, so like a vague complaint of an infant with difficulty feeding, or a baby just doesn't hold its head up well, could be early signs of botulism, and then it progresses to generalized weakness, paralysis, respiratory failure. So it's good to kind of catch early. So you kind of have to suspect it early. And now, because of this outbreak, it's good to kind of think about it. If it is diagnosed or suspected, because the diagnosis takes several days. So if we suspect it, you can treat it with an antitoxin that can prevent the progression. But something to think about early. As far as I saw this morning, there were still no cases in Colorado, but there's some in Arizona and some nearby states, California. So, things to think about. See an infant with kind of strange complaints, maybe weakness related, poor feeding, something to think about. Thanks, everybody.
This has been the Emergency Medical Minute. Thank you to our sponsors CarePoint and HCA Health One. Support from them and listeners like you helps us to continue providing free medical education to the masses. If you found this episode valuable, consider supporting our work and check out the link in our show notes.